Now let's now move on to our regular segment for Mondays, where we turn to a medical expert for a more in-depth diagnosis on the current issues surrounding COVID-19. For this, we have Dr. Alice Tan, internist at MizMedi Women's Hospital via Skype. Dr. Tan, thank you for joining us.
Thank you for having me.
Now, like we discussed last week, the situation has gotten worse, with South Korea reporting more than 3,000 cases for the first time over the weekend. Now, after the Chuseok holidays, measures have returned to their highest levels, especially in the capital area, until the Sunday, when it may be revised. Now, at this point, where social distancing is at the highest level in many areas, what options do we have to stop the spread?
Well, as has been the case throughout the pandemic, it needs to be a multi-layered, multi-pronged approach. First of all, I think testing could be massively expanded. There could be private-public cooperation to get more rapid antigen testing throughout the country. In any congregate setting where the majority of workers or students are not vaccinated, I think rapid antigen testing could be done more frequently. Also, we talked about the kind of vaccination rate that needs to occur in order to get to a greater than 70% population fully vaccinated by the end of October. There's no reason to wait until the end of October. On days where there are high vaccination rates, more than 1 million doses of vaccines are delivered daily. I think that's the kind of rate we need to see every day going forward. Also, as we talked about, last time, since we talked, the cases of unknown epidemiological link, that number has now surpassed 10,000. That means one out of every 10 cases, 4, they just have no idea the source of their infection. This tells me that the epidemiological surveillance system is overwhelmed. And so I think we need more manpower to help with the epidemiological survey and investigation. And also, the public can help in this regard by trying to stay at home as much as possible. Work from home, study from home, socialize from home, shop from home. Now is the time to try to stay at home as much as you can.
Now, Dr. Tan, in South Korea, winter season is approaching, and I'm not sure if it's because of this, but as far as I remember, we saw more infections over the winter period last year. Now, with South Korean government planning to shift the living with COVID-19 system after October, do you think the weather could be a factor that could hinder such plans?
Yes, absolutely. So the winter season is traditionally when respiratory-borne illnesses, such as the cold and flu, and last year we saw COVID-19, they tend to spike. The cold temperatures, they cause people to close their windows, close their doors, and so there's less natural ventilation indoors. And also because it's cold, people are spending more time indoors. Finally, the humidity levels are much lower in the winter months, and that makes the spread of respiratory droplet and airborne infections that much easier to spread. So I do suspect that there could be, as you're saying, environmental factors that can lead to an increase in COVID-19 cases. That's why it is so important to try to get our vaccination rate high before the winter season sets in.
Now, the CDC and the FDA last week gave the green light to begin giving booster shots to the vulnerable group, and the U.S. has officially started offering the shots. And South Korea is also set to announce its plans on this front today. Now, many of us already know that booster shots raise a vaccine's effectiveness, but does it mean 2 doses of a vaccine is not enough? How long does the vaccine's effectiveness last?
Well, it's important to clarify that for people who are immunocompromised, 2 doses are not enough. So a 3rd additional dose is needed to complete what we call the primary series and to get to a full vaccination rate. In terms of a 3rd dose as a booster, the CDC announced that they were seeing signs of waning immunity in populations that were 65 and older, and also in residents at long-term care facilities. And so that's why these 2 groups had the strongest recommendation for receiving their booster shot, and the timing would be 6 months or more after their 2nd dose of the Pfizer vaccine.
Now, lastly, South Korea is also set to announce its plans to inoculate pregnant women today. But many women who are pregnant or those who are planning to have a baby are still hesitant as there have been worries over the possibilities of menstrual disorders or bleeding. Now, as a medical expert, do you think it's safe for them to take the shots as well?
Yes. So in early August, the American College of Obstetrics and Gynecology issued a strong medical consensus statement urging all pregnant individuals to get vaccinated against COVID-19. And the rationale is because pregnant women have a high chance of developing severe COVID-19 and also from dying due to COVID-19. And also tens of thousands of reports from pregnant individuals who had received the COVID-19 vaccine show that the vaccine is safe and effective for the pregnant woman, and also safe for the baby who is born to a pregnant woman who receives the COVID-19 vaccine. And so these are the data that make it compelling. Furthermore, there is no impact of the COVID-19 vaccine on fertility. There were some concerns, I think, circulating that it might affect a woman's fertility, but that is simply not the case. And so we do strongly, as medical professionals, recommend pregnant women to get vaccinated against COVID-19.
So again, vaccination is a must. All right,
yeah.
It's time for us to wrap up our discussion for this week. This was Dr. Alice Tan of MizMedi Women's Hospital. Dr. Tan, thank you again for your wonderful insights. We'll see you again next week.
Thank you.